Okay.
It is. There we go. Okay. So we are recording. I just want to say welcome to everyone. My name is Elizabeth Johnson Phillips. I'm the content developer with MPWRSource, and I am here this morning with Angela Simmons, the principal consultant of CentraVance Consulting. And we are going to be discussing regulations in the funeral services industry. And, I got to get it out of the open. I just let me have one. I know this morning, Angela, you're going to knock them dead. Can I have one?
You
That's my
got one.
That's yeah. Okay. Thank you. Thank you. First, before we sort of get into the questions, tell us a little bit about why you have the ability to speak to this. Like, tell us a little bit about your, how you know all things compliance.
Yeah. So my background is in healthcare and regulatory compliance. And so when you think about that, you think, okay, so healthcare, post-mortem care, it's still people, right? And so at its very base, at the core, we're still talking about people working with people. And on whatever end of the spectrum we are on, there's still rules that are in place for us to ensure that the living who are working with either the ill, the infirmed, or those that are deceased are kept safe. And so that is my area of expertise. Been doing this for about 20 years, 25 years. And so I can always come in and speak to the OSHA, the infection control piece. How do we keep our employees safe?
And I would think in the healthcare industry, obviously, some of those parameters are put in place for your employees and patients, but
right.
The patient's part, that's not, but in the OSHA piece for funeral services, it's still, you want your employees to come to work and leave work the exact same. So that piece is the same.
Yes. Yeah. So no matter what setting you're in, and you know what, I think this is true of any industry, right? Whether I'm in the healthcare industry or I'm in retail or the food industry, I want my employees to come to work and I want them to go home the same way that they got here, I hope. Maybe a little tired, maybe feeling that, a little bit of satisfaction from a day's hard work, but I don't want them to go home sick. I don't want them to go home injured. I don't want them to go home any worse for the wear than they were when they showed up that day. And that's what OSHA is all about. OSHA is about making sure that our employees have a safe working environment free of known hazards.
So how does OSHA apply to funeral services?
So OSHA applies to every member of the American workforce. So there's a few exceptions, but as a general rule, if you employ workers in the U.S., you in some way, shape, or form fall under the OSHA rules. The important thing is to remember that OSHA is absolutely about employee safety. It doesn't have anything to do with client safety or patient safety, and then obviously, in this case, decedent, right? But it is about making sure that we keep our workforce safe. So when we look at OSHA and we look at the funeral services, then what we're looking at is definitely standard precautions. The bloodborne pathogen standard, the hazard communication standard applies. We have some rules that surround formaldehyde use because we're going to obviously see that in the embalming rooms. Emergency planning is going to apply. So definitely lots of different areas of application of the rules. And when OSHA can't find something that they view as a violation that lines up neatly into one of their standards, then they throw out the general duty clause. And so when you stop and you think about that, so it's like we've got you one way or another if we feel like or we perceive that the working environment's not safe.
So that general duty clause is sort of okay, here are the rules, but just in case we haven't thought of this context, we're going to slap this rule on there too that just sort of covers all our bases.
Yes, that is exactly.
Sounds like my parenting.
Yeah, that is exactly what the general duty clause is. It is a catch-all. And it's very clear when you read through the general duty clause that that's what it is. It doesn't mean that just because Angela walks in from OSHA, I don't work for OSHA, but Angela, whoever, walks in from OSHA.
Let's name her Karen. Let's name her Karen, Angela. It's Karen.
There we go. So it doesn't mean that when that person walks in that and they see something that they perceive as an unsafe environment or a task being performed in an unsafe manner, they're going to cite for that. It doesn't mean automatically that the entity is going to be, that citation is going to be held up, and it doesn't mean that they're going to be fined, because there's still going to be that due process, right? We can still appeal it if we feel like, gosh, this is kind of really out there on the spectrum, and then it'll go kind of up the chain with OSHA, and they'll look at that. The experts will look at that, determine if there's anything in the rules anywhere, or if this is just one of those cases where there may have been a perception that there was something wrong, but we can't really find anything to substantiate, or gosh, we may not have anything very specific, but this is obvious that this is a risk.
Now, another thing I know you deal with a lot in the healthcare industry, and I don't know, I'm trying to imagine how this applies to funeral services, but does HIPAA apply to funeral services?
No. So let me say a couple of things. HIPAA does not apply to funeral services. It does apply to the records of decedents, but only as that relates to the records that are held by what we call covered entities. So because when we get to the funeral home, right, when we get to this part, so we've got a patient that is in hospice, that is in a hospital setting, or even, they pass away at home or in a car accident, whatever the case may be. Everything that surrounds their health care up to that point, anything that is filed to insurance, to health insurance, is, as a general rule, going to fall under HIPAA, and it's going to be protected in that way. Once we move, though, from health care to death care or funeral care, now we're outside of that realm of covered entities, and so HIPAA no longer applies. That doesn't mean that we should not have information security in place. We absolutely should, but the HIPAA rules in and of themselves do not apply. And there's the unfortunate thing is that we do not have a national privacy rule. We have a privacy rule as it relates to HIPAA and information that is held strictly by covered entities, but we do not have a privacy rule as it relates every single day to that same information held by other entities. So we don't have a privacy rule, but then when you look at every state does have breach notification rules. So it depends on what type of information you hold, how that information, how it's compromised, what type of compromise it is. Sometimes it's how many people's information is compromised. Sometimes it is, did I have names and dates of birth and social security number? So it just depends state to state. And so for any industry, I would say you need to have an information security program in place, even if you don't fall under the HIPAA rules.
Okay, that makes sense. So I know under OSHA, and you've mentioned a few of them, and just because, where I work and what we do, we like to plan. What sort of plans, to be OSHA compliant, what sort of plans do I need to think about to have in place?
All right. So do I get to talk for a little while here?
You have the floor.
I have the floor. All right. So when we think about anybody that is related or works in a field that is related to the care of the human body, right? So OSHA applies to the entire American workforce with few exceptions. And so if I'm working in the retail industry, financial industry, you've got to provide me this working environment that's, free of known hazards, right? I'm supposed to be able to come to work in a safe environment, go home just the same as I left. But when we think about anybody that's working in care of the human body, the issues now are not as clear. The risks are not as clear. So there's a couple of things that we absolutely know about healthcare and the human body, and truthfully, funeral services, death care and the human body. We don't always know everything we need to know in order to keep our employees safe. So if we think about it from the healthcare perspective, we have patients who will come into our practices and they don't tell us everything we need to know in order to best treat them, in order to best care for them. So let's say, perhaps you have a patient going into a dermatology practice for X skin lesion. We ask them if they have heart conditions, if they're diabetic. We ask them, if they have any other infectious diseases, if there's anything else we need to know. And what we often find is that as people, we look at it and we start weighing out, do they really need to know this, right? So I'm going to the dermatology practice. Do they really need to know that I'm HIV positive? Do they really need to know that I had X or Y or Z, or that I have this cardiac condition? Because they're not treating me for that. So we know that at its very best, our health records are extremely flawed. Sometimes patients don't want to tell us things that they really should, and sometimes they don't know to tell us. So we end up with patients who are hospitalized with disease processes that they didn't realize that they had, and that's why they're hospitalized, or they're hospitalized for one disease process. We find out that they have another. So you have that whole conundrum. Then you have this issue of now, when we do move from care of the living to taking care of a decedent, how much communication is going on between the hospital setting, the medical setting, whichever setting it is, and the transfer of that body. And the reality of it is that I think that we do give funeral services the short end of the stick, if you will. They don't always get all of the information that they absolutely need to know so that they can care for that body. Once somebody has passed, that does not mean that they're no longer infectious. It does not mean that they are no longer a risk to the employee who is taking care of that body and seeing it through to its final resting place. And so I think that this is really an important thing for us to stop and think about. So anytime we're talking about caring for humans, the bloodborne pathogen standard applies. And so we recognize this is the X. We recognize that anybody that we're dealing with could potentially have infectious disease. Because we know they potentially have infectious disease, there are certain guidelines that are put into place. The huge one in all of healthcare is standard precautions. So the bloodborne pathogen standard then comes down and says, okay, so depending on what you're doing, the task that you're performing, you may have some different precautions that you need to put in place. Standard precautions recognizes that every body is potentially infectious. So because of that, I wear the appropriate PPE based on the task that I'm performing in order to keep me safe. And this is the responsibility of the employer to perform a hazard assessment, to know what the risks are, the potential risks are to their employees, and then to provide the appropriate PPE. And so as we're looking now at our current environment in both healthcare and funeral care, we recognize that the X is pretty huge, right? Because we still don't understand. Right, we still don't understand a whole lot about COVID-19. We know that generally speaking, it's passed from person to person. That is still thought to be the way the primary mode of transmission is person to person. So within 6 feet, somebody that coughs or sneezes into the air. And so you're exposed to either the aerosolization or the droplets. And then, of course, we know also that contact, right? So I cough into my hands and I touch other surfaces. So when we think about this, those types of things in our world, in the funeral services world, standard precautions is important, but now so is contact precautions. So contact precautions recognizes that I'm going to be touching a surface, or I'm going to be touching a body that is potentially infectious, that could have X, Y, or Z. And because of that, I'm going to wear the appropriate PPE for this. And then there is also some element of respiratory precautions as well that needs to be added in to the funeral services, because we do recognize that unfortunately there's still, or it is a fact of life, that as we are moving bodies and transporting bodies, that air is still going to be expelled from the bodies. And we know that as we go through the processes of preparing those bodies for their final resting place, that we're going to introduce fluids, we're going to remove fluids, and so all of that's going to put employees at a potential risk. So standard precautions, contact precautions, respiratory precautions, all have to be considered, airborne precautions when we're working with the deceased. And that only covers the bloodborne pathogen standard. That doesn't get into any of the other plans. You have to have, under the bloodborne pathogen standard, you do have to have an exposure control plan. So one of the things that's a big concern, and I'm kind of going to guess that this is maybe even more of a concern today because of what's happening, right? Our medical systems are overloaded right now. We see, well, I guess that's kind of a 6 of one, half dozen of another, because where we see a lot of COVID, our emergency systems are overloaded, our hospitals themselves are not. But what happens when you end up with a pandemic and you have a situation where you have unfortunately a high turnover, right? So I have people that are passing, and then we need the funeral services folks to come in. They're going to pick up these bodies. They're going to take them so that they can get the bodies prepared. Sometimes there's miscommunication. So sometimes there's hospitals or medical facilities not telling the funeral services people what they need to know. But then there's also the things that we have to think about was, how long was that person in the hospital? Did they have IVs, right? Is there any emergency type equipment that is still left on this body, any sharps that are still left on this body from any emergency procedures that were performed on this patient? Because in the end, right, once it's called and they drape the body, the emergency or the hospital workers may not be thinking about, I should pull this IV, I should pull this needle, I should remove this, I should remove that. And so now we've got funeral service workers who are coming in, sometimes drivers who are coming in to pick up, and they don't realize that, there's still an IV line in this body. So there's a risk to you. So this is part of the exposure control plan. What are all of my risks? And how do we address those if we do have any kind of an exposure? Because a needle stick is a needle stick is a needle stick, whether it's a living specimen or not, we still have to follow a protocol for that. One of the other things that I think is going to be real important is infection control at this point. So, and again, you look at it and you're like, does infection control really matter in this setting? It does from a lot of different perspectives, but probably the most important perspective at this point is your employee safety, right? Because if we are prepping bodies that were infected with COVID-19, whether that was the cause of death or not, if we are prepping bodies for that and we're using different instrumentation for that, then the likelihood that our employees are going to come into contact with that virus raises exponentially. So what do we have in place to ensure that our instruments are staying clean? So sterilization is it's not something that is firmly set into place in the funeral services world, but it is a very important piece of what we do. And it's more there is some element of protecting a body, right, from decomposing too quickly. So there is some element of that, but there's a huge element of how do I protect my employees knowing that we're likely dealing with somebody that could have an infectious disease. So bloodborne pathogens, the standard itself requires an infection control plan, an exposure control plan. I think under the infection control, we'll probably be looking at strengthening that with a COVID or a pandemic type plan.
That makes sense to me. Have there been changes to the OSHA requirements for funeral services in light of COVID-19?
So this is what's kind of interesting to me. So I'm a regulatory person. And so this is what's been kind of interesting to me is kind of watching what OSHA has done and the stance that they have taken over the past 2 months. So at first, they came out with what they called some interim guidance. And it was very clear, this is guidance. There's no regulatory weight behind this. There's no power behind this. This is simply some guidance on what can you do to help protect your employees. However, they have since then come out with more guidance that sounds like it carries a whole lot more weight. And so I think that we will see, because obviously it's going to have to go through the process, right? You can't just change the rules. You got to go through the process to get rules changed, to get laws passed. But I suspect that we are going to see not just interim guidance, but we're going to see a change to the rules as well. And some of that is simply going to surround what did we already know? What were we already supposed to be doing? And now strengthening that. I think the one big change that we'll see, and this is everywhere in healthcare, right? Who needs to wear an N95? That's going to be the one big change. There's always been the requirement to provide the appropriate PPE. And when I think about funeral services and death care, we should be wearing masks. We should be wearing safety glasses. We should be wearing outer PPE, so an apron, things like that. We should be wearing gloves. All of those things should have already been in place. The question comes down to, is it a level 3 mask or is it an N95 that I need to wear based on what the task that I'm performing? N95s prior to COVID-19, those were needed in situations where we were aerosolization or aerosol generating procedures where we had known or suspected infectious disease, respiratory infectious disease. Now we're seeing a huge shift where the N95 is required even with well patients if there's anything that's aerosol generating. So we do have to think about that in even the death care world. How do we take care of our employees as they take care of our decedents?
Yeah, I mean, I even know the change in the mask when I took my kids to the pediatrician. He was wearing an N95 and we were all there in our homemade masks. So there's definitely been changes across the board. Has the CDC issued any guidance for funeral services?
Yeah, everybody has issued guidance. And I will tell you that everybody kind of points back to the other person. So a couple of things that are important to know is, like, who's the voice of reason in all of this? Because you'll have
always a valid question.
Yeah, so if I just look at funeral services, right? There's the Virginia Funeral Directors Association, the Virginia Morticians Association, the Association of Independent Funeral Homes. There's a national association. Then we have the CDC. We have OSHA. So we have all these people who are putting their 2 cents in on what we should and should not be doing. The one good thing that I do think that Virginia did was Virginia pointed back to the CDC and also said, we already had rules in place, continue to follow them. And so I think that's an important thing. But if I'm looking and I'm trying to decide, gosh, I'm hearing conflicting information, who do I listen to? OSHA's the regulatory entity in all of this. And so, but here's the caveat to that is that OSHA leans very heavily to the CDC to define what some of their regulations actually mean. So it's kind of like, Congress, I guess, and the Supreme Court. We've got rules that are put out by OSHA, and then they rely on the CDC to kind of go in and define those for us, to kind of explain what they actually mean. And so we do there needs to be some level of paying attention to both OSHA and the CDC. I think we should consider OSHA the floor. So this is our minimum requirement. And if the CDC comes in and says, hey, you need to raise the standard to up here, then you need to raise the standard to up here, because this is about keeping your employees safe. So if we consider OSHA the floor, anything that falls under that doesn't require that same level of protection, we don't listen to that. But anything that says, gosh, there's a higher level of protection you can put in place, then that's what we should be doing. And that is the standard you're going to be held to. If there's ever a bad outcome, you're going to be held to what the standards for entities like the CDC were.
Yeah, because I think that not only are you in any business protecting your employees, but you're also protecting, I know CentraVance's tagline is protect your brand, protect your reputation. You're protecting how the public views you. So if there is a bad outcome and they find, well, you were just doing the bare minimum, that doesn't work for any industry.
Yeah, let's face it. you can, I was thinking about this earlier today. So OSHA is about your employees, right? It's about keeping your employees safe. But how do I explain that to a family member? That OSHA wasn't about me keeping your family member safe or getting them to the end point that I was supposed to get them to. OSHA was really just about me keeping my employees safe. And either I did or I didn't do that, or I had no consideration for how this may play out for the loved one that you put into our care, right? And so I think we really do. We've got to step back, and this is all of healthcare, right? From whichever spectrum we're on, from the newborn to death, we need to take a step back and we need to look again and reevaluate what was there already. What did the bloodborne pathogen standards say about keeping your employees safe? Because reality is that if we will do the right things to keep our employees safe, we're going to keep our patients safe, and then we're going to care for our decedents in a manner to which their families expect, so that we can get them to their final resting place as the family would expect that to be, right? This is a touchy time. It's a very emotional time, and it's not a place that anybody obviously wants to be. But if we're all there, we need to find a way to make that process as grief-free, if you will, as we possibly can, so we don't need to add to it.
Correct. That's what I was just about to say. There's already going to be grief. There's already.
We don't want to add to it. So
right.
how do we make sure that we don't end up with bad outcomes? How do we make sure that we don't end up in the news? Because what's reality? If you end up in the news because of a bad outcome, whether that bad outcome affected your funeral services or not, what are the people who have used your establishment going to see? They're going to see a bad outcome, and they're going to be thinking, oh my God, my loved one was not taken care of in a manner that they should have been taken care of. So yeah, I think this is really important for us, especially with COVID-19. It's time to step back. It's time to take a look, put the controls in place that we should have already had in place, and make sure that we absolutely are, because whether we want to admit it or not, we do have a reputation to protect, whether we're working on the newborn spectrum, somewhere in the middle, or we're working on the death spectrum.
And that's the thing with reputation. Sometimes it's an allegation. It doesn't even have to be the same. But if you can, if you can point, if you're a funeral service director, if you can point, we already have these plans X, Y, Z, and Angela from CentraVance came and gave us this training. Here are all the hoops we jumped through to mitigate any bad outcomes, because things are going to happen. But if you can show that you've gone above and beyond and been due diligent, I think that would go a long way towards, smoothing things out. But you've mentioned a couple.
Yeah, I think that's. Oh, go ahead.
No, I was going to sort of go back to some of the nitty gritty things. So finish what your thought first before.
Hey, I'm good. It has already left the room.
Oh, okay. Awesome. That's great. Way to bring it back to me. Now, you mentioned earlier that the need for appropriate PPE, and from what I'm understanding, you're saying is that funeral services, if they receive a body, they need to just assume the worst. Not assume the worst. That is definitely not the best way to put it, but just assume that this person has an infectious disease, and we're going to we are going to protect ourselves with that mindset. We're going
that is reality, right? Because even in working with the living, that is the assumption. When that patient walks through that door, my assumption is that I'm going to assume the worst. They have the worst infectious disease. And so to that end, whatever my interaction with that patient is going to be, I need to make sure I'm protected. So do I need safety glasses? Do I need a mask? What type of mask do I need? Is it a level 3 or is it an N95? Should I have a jacket on? Should I have gloves on? What do I need to do to protect myself? And that's what doing a hazard assessment is all about. assessment is required for anybody that falls under the bloodborne pathogen standard. So this is our medical offices, our dental offices, our hospitals, our hospices, long-term care, and this is death care as well. Anybody that's dealing with the human body on any end of the spectrum, we need to do a hazard assessment. We need to know what our risks are, and we always assume, so the assumption is always that the patient either is not going to be able to tell you or they don't want to tell you. So you're not going to have all of the information that you need about their disease status. So we just assume the worst from the outset.
Because inherently, I don't know if you know this, but a dead person can't talk. And not every, I would assume not every person coming into a funeral home, you're actually not going to know why they died. Not every person has an autopsy. I would say probably most people don't come with a piece of paper that says they died from XYZ. So you just need to assume. So what, you've mentioned N95s a couple times, you've mentioned gloves and glasses and an apron. What specific PPE is required for funeral services employees? And is that an N95 or its equivalent?
So I think that we are probably going to see a shift that way. If you are working in any capacity where you are taking any samples from a body, where you are going to do anything that could produce anything aerosol generating, droplet generating, and we do know that, you know, in the embalming process that, yeah, there's absolutely a risk of spray and spatter. So I think we are going to see a shift to the N95. Has that been established for anybody in the healthcare world at all? No. It has not been required so far. But do I think it's coming? Yes. And when I see interim guidance that says we're supposed to do that, then that speaks a whole lot to me. One of the other things that OSHA did just recently was they looked at all of the industries. And so what do you do as a worker in the American society, and how does that relate to what your risk for contracting COVID-19 is? So if you have a job that doesn't require you to have contact with people who are known to be or might be infected with COVID-19, then you're going to be pretty low risk. So we go from low to medium to high to very high risk. And mortuary workers involved in preparing bodies for burial or cremation of people known to have or suspected of having COVID-19 at the time of death are high exposure risks. And so what do we know about what's happening right now? The assumption should be everybody, even if my cause of death was, you know, cardiac arrest or COPD, or I had cancer, whatever the case may be, we know that those processes may be the primary, but COVID-19 may be a comorbidity. Mm-hmm. And that's our concern now, is how many people that we do have that are passing away, how many of them have a comorbidity that includes COVID-19. So we should just automatically, based on what OSHA has done, treat your employees as if they are high risk. And because they're high risk, we're going to put PPE in place that's going to keep them the best protected. And I think this is also a place where we quit letting employees make decisions on what they will and won't wear, right? That's what the rules require. Here's the standard. Here's our policy. This is what you're going to do. The rules require that you do a hazard assessment. Based on the hazard assessment, you provide the appropriate PPE, make sure your employees know how to use that PPE, and then make your employees use the PPE. We have to do that. We've got to get back to that.
Yeah. So what does, there's lots of, you've spoken about the different standards and precautions that are needed in place. What does comprise a complete OSHA compliance program for funeral services employees? Like you've said a couple times, hazard assessment and things like that. What is all, I'm a funeral service director and I want to be compliant, so I'm going to hire Angela. What's next?
So if you're going to have a complete program, right, The first part of that is going to be training, and that is a requirement of the bloodborne pathogen standard, period. I am not a fan of static training, and the reason that I'm not is because, first of all, it doesn't give employees the opportunity to interact and ask questions, which is something that the rule says that they need to be able to do. The other aspect of that, or the flip side of that coin, is that when we are talking about the funeral services world, there's not this like 8 to 5 timeline that they have. And so it could be that it's very difficult to schedule a training for those employees, for those workforce members. And so making sure that they do have not just a training that was recorded back in 1995, but what's most up to date, what's most reflective of their environment, and then who do I go to if I have questions, right? How do I get my questions answered? So training is the first part of it. Immunization would be the next thing in place. So we need to have a training plan or a program. We need to have an immunization program in place. And so that is, at this point, making sure that we're up to date on immunizations. Flu vaccine, probably pretty important when we're working in the healthcare world. We do have some cases of death care workers contracting the flu from a body that they were transporting from hospital to the funeral home. And so that's an important thing for us to remember as well. So the immunization piece. Hepatitis B, that's the only one required under the standards, but the CDC does recommend that you're up to date on all of your immunizations. And so then you have an exposure control plan, you have an infection control plan, you need a hazard communication plan. And that's pretty important because of the types of chemicals that we work with in this industry. They are, all of them, by the very nature of what they do, are extremely hazardous to human life. And so having the appropriate hazard communication plan in place, having the appropriate SDS, safety data sheet repository in place, having a good ventilation program in place, right? Because I'm going to be in a room potentially where we're using some chemicals that could be hazardous to my health. A driving safety plan, an ergonomics plan, general duty, emergency plans. So this is it's a pretty wide and broad spectrum of plans and policies that need to be in place. Starts with training, ends with training, and a bunch of policy in between.
It sounds like it needs to be a little bit more in depth than just having a binder and saying, hey, go read that binder. But there is the binder, because if something goes wrong and you don't know what's in the binder, it's too late. You're not going to be
right.
Sitting.
So I see a couple of things with that. I am not a fan of buy an OSHA manual that says it works for a medical practice, buy an OSHA manual that says it works for a dental practice, buy a OSHA manual that says it works for funeral care. Because here's the deal. Can I create a boilerplate? Yes. But how does that apply to my establishment? How does that apply to my business? Because it really doesn't. It's a boilerplate that says, oh, you should do X, Y, and Z. But what OSHA requires is that your plans, your policies need to relate directly to your establishment. So how,
if context your business is in.
Yeah. So if I'm the employee, what are the things that we absolutely do, that we actually do here, and what is the PPE that's going to be required? Because you know what, OSHA is the floor, right? And so maybe OSHA says, here's what I'm supposed to wear, but my employer says, you know what, in light of X, Y, or Z, I think that we're going to raise that standard a little bit. They can't relax it, but they can certainly raise it, right, based on what you're doing. And so how are we, based on our hazard assessment, right, which is unique to every practice or to every establishment, to every business, how are we ensuring that we know exactly what the hazards are that are associated with this specific business, and then we're applying those appropriately? When you think about emergency plans, yep, we need to get out if there's a fire, but where are we going? Right? Do we have the right fire suppression equipment in place? Whose job is it to do X, Y, or Z? And where are we meeting when we get out of this facility? Because OSHA is all about protecting the employees, right? When we think about an infection control plan, What's going to be very specific to our area? So are you going to be allowed if you're sick, right? Even in death services, should I be allowed to work sick? Probably not, right? Because I don't need to make everybody else that's working in the establishment sick. And I need to be able to get well myself. And if my immune system's down, then I'm going to be more susceptible. So hazard communication, that's going to be very specific as well. You're not going to have every chemical known to man in your establishment, but you do need to have a hazard communication plan that is inclusive of the chemicals that you do have, and speaks to how you do take care of and ensure that your employees interact and use those chemicals safely. So driving, ergonomics, all of that is going to be very specific to every single establishment.
That makes sense to me, because even the driving plan would need to be different if you're in a rural community versus if you're in a more, urban place, because of how just logistics.
Right. And you also, so in those situations, they'll also have to consider, insurance may play a role in that, right? So as you are insuring your vehicles and your business, looking at who's driving your vehicles, what's their past driving history, have they had, do you have a policy in place, do you have some kind of training in place that these employees go through, may affect the how high or how low your premiums are, based on what you actually have in place and what your employees know about safety.
This is a lot of information. I'm not going to lie; it's a little bit more information than I was expecting. No, but that's what This is a new field for me, I will say. But even if it weren't, this is still a lot of information, and so I think this is definitely an area where I can see the need for. This is too much for some random person at a funeral home who this is not their wheelhouse to be in charge of.
Yeah, so here's my view on compliance, and anybody working in human care. You, as a person working in human care, you have this awesome responsibility to take care of that body in whatever shape, whatever form it comes to us. And so your mind has to be full of all of the information that is required to provide the best care to that body right now. If you also have to have in your mind, okay, what does the bloodborne pathogen standard say about this one again? What is the infection control plan? Is there an emergency? Anything? Is there ergonomics that apply to this? It becomes so much more difficult because now you got all these voices that are competing in your head. I have no competing voices in my head. The only thing I think about is compliance. I am that nerd that loves compliance. If I also had to think about what are all of the things that go into caring for this baby, caring for this teenager, caring for this adult who has XYZ disease, taking care of this body whom a family has entrusted me to see through to the final resting place. Those are all the things that should be on that healthcare worker, that death care worker's mind, not what's going to happen if I do X or Y or Z, not what is OSHA going to say, not what is the CDC going to say, not am I going to get in trouble. You need somebody that worries about the regulatory piece for you. We keep you straight on that end, and you take care of the human body. Right? That's where your focus gets to remain, because let's face it, why do you go into medicine? Why do you go into funeral services? Why do you go into any area, any profession that you go into? Because that's what you want to do. That's what you love. That's what you want to focus on. The unfortunate thing is that in our society, we are a heavily regulated society. And oftentimes the regulations and the guidance that's out there is very conflicting and very hard for us to piece together and understand and know who do we need to listen to, what do we actually have to do versus what should we do, versus what will be the outcome if I don't do something that was just recommended. So it's a lot to think about, a lot for them to have to carry.
Yeah, so it makes perfect sense. You get to be what you're an expert in. They get to be what they're an expert in. And some of that, the training that you've mentioned, and I appreciate you saying not being static, because training will provide muscle memory. Training will provide, that becomes the habit. So a person working in the funeral care services industry, they're not having to think about, do I wear this PPE? Because that is now habit. I've done enough training that this is my norm, that I put this mask on, that I put these glasses on, that I put these gloves on. This is not, oh, I have to look at a list. Like maybe in the beginning, yeah, as they start the training, it's going to be a shift in the way perspective. But after a while, this is going to become normative. And that's the goal of good training.
Right. So a couple of things about the training requirements, right? The bloodborne pathogen standard requires that you train employees within 10 days of hire, and then that you train them on an annual basis. And it is because of situations exactly like right now. We have an emerging disease, right? We've known about coronavirus for a very long time, but having a pandemic such as COVID-19, this is why we do training. This is why we have those reminders on an annual basis, because, hey, look, we're dealing with the human body. And because we're dealing with that and we're dealing with the unknown, we've got to make sure that you're protected. It's a whole lot different than working with a fall and trip hazard, right? It's a whole lot different than working with an electrical hazard. This is a human body hazard. And so the bloodborne pathogen standard requires within 10 days of training and then on an annual basis. The hazard communication standard requires training within 10 days of hire, and then as you make changes to your chemical inventory or how you handle and use your chemicals, and then if there's any changes to the rule. So that was 2013 was the last major change to the hazard communication standard. And so truthfully, if you haven't trained in hazard communication since before 2013, you're a little overdue because we were.
And I would just think that was 7 years ago. So and as you said, you're suspecting there's going to be some shifts in terms of PPE requirements, perhaps, and stuff in light of COVID-19. So everybody is due for some training. Yeah, whether they're a new hire or an old hire, everybody's due for some training.
Yeah, and you know what? I think this comes down to, and I know I've said it several times over, we've always had some rules in place. It really is time for us to get back to those rules. And it is time to make sure that our employees know what they are, that our employees know how they apply to them, and that our employees know that we're serious about making sure that they go home safe at the end of the day, because that's what it's all about. So what did the rules already say? How do we apply those rules? How do we make sure that we are keeping our employees safe?
All that makes sense. Thank you. We are reaching the end of our time today, Angela, and I know I learned a lot. And if folks who watch this want to get in touch with you, what's the best way to do that?
You can reach me at angela@centravance.com or support@centravance.com. And you can reach us at 804-977-1201. 804-977-1201.
Thank you so much, Angela, and I hope that everyone who watches this learns a lot. Thanks.
Thank you. Take care.
Thanks. You too. Bye-bye.